Hello, I'm Dr. Suresh Rao. I'm a children's heart surgeon at the Kokilaben Dhirubhai Ambani Hospital. I'm here to talk to you something about congenital heart surgery and congenital heart disease. Congenital heart disease is a developmental deformity of the heart. So, when a child is being formed in the mother's womb, when the heart develops, the deformity is programmed to develop from that stage. So, when the child with this kind of deformity is born, then he or she is thought to have congenital heart disease. Now, this type of congenital heart disease can be very many types. One, some of the congenital heart disease may be extremely minor, which we may not have to do anything and it sets right on its own. But the others, they require some kind of an intervention as the child grows because it could be a serious matter. Now, if you see the model of this heart, basically congenital heart problems can occur from the great arteries, then the valves, which you can see here, and this is the left side of the heart, the right side. In between there is a partition in the septum. So you can have holes in the septum. In the lower part it's called a ventricular septal defect, upper half it's called atrial septal defect. Then you can have problems in the venous drainage from the lungs, the connections between the lungs and the heart. So there are many types of congenital heart disease. Like I said earlier, some can be simple and some can be extremely complex. Another important thing about congenital heart disease is some of the children are born as blue babies. Some of them are blue, some of them are not very blue, but both have congenital heart disease. The blueness is because of the mixing of the blue and red blood inside the heart. So the blue babies generally have got a more serious form of heart problems than the non-blue children. A child with congenital heart disease, if it is detected early, if it's corrected at the right time, has a very bright chance of living a normal life well into adulthood. And now we have children who have been corrected even as newborns, as small children, growing up into adults, doing all kinds of courses and becoming professionals. What are the myths? Earlier, we were always having, you must have heard, the child has to be a certain age, the child has to be a certain weight, at which the surgery or the interventions cannot be done. But I think in today's practice, that is not so. So we've had corrections done even from day 1 of life, day 2 of life. So what I'm trying to say is the correction is done as soon as the diagnosis is made. So it can be done at a few days of age, few months of age, and in a sense earlier the better. So how early can we diagnose congenital heart disease now? We have got extremely good echo machines now which can diagnose congenital heart problems right from the 18th week of gestation, 18 to 20 weeks of gestation, and then we can inform the parents and they can make an informed choice whether what is the lesion, what is the future prognosis, what is the corrections possible for that baby. So today, in today's practice, congenital heart disease can be diagnosed even before birth, but more commonly it is picked up immediately after birth and the treatment sought after. What is the success rates of congenital heart surgery? Well, it is anywhere over 95 to 98%. So sometimes in most of the commoner lesions it's close to 100%, and all these children can really enjoy a normal quality of life. So my advice to you all is to see to it that a baby is checked when it is small, and the earlier we intervene, it is best for the child. And don't deter the child or make him or her feel that he's handicapped in life. So once a child is fixed, corrected, I think they should be able to lead a normal life.